What if I told you that one of the deadliest respiratory viruses in America could be hiding inside an old garage, a dusty shed, or even a cabin that looked completely safe? And what's terrifying is that many people never realize they were exposed until they're lying in a hospital bed fighting to breathe. This virus is called hantavirus. And once serious lung symptoms begin, health experts warn the condition can turn life-threatening very quickly, especially for adults over 60. In several reported cases, people believed they only had the flu, until days later their oxygen levels crashed and their lungs began filling with fluid. The scariest part? You don't need direct contact with a sick person to get exposed. Sometimes, simply breathing contaminated dust while cleaning a storage space or opening a long-closed room may be enough for exposure. Before we continue, I'd love to hear from you, and I personally read every comment. Have you ever opened an old room, garage, or storage area and noticed a strong dusty smell, rodent droppings, or signs of mice? Let me know in the comments below. Today, we're uncovering everything you need to know about hantavirus, what hantavirus really is, how it spreads, what it can silently do to the body, real infection cases, and the most important protection steps. Stay until the end, because the final information could save your life or someone you love. So let's start with the most important question: what hantavirus really is, and how this virus spreads. Hantavirus is a rare but potentially deadly virus carried mainly by rodents, especially deer mice found across parts of North America. What makes this virus especially dangerous is that the animals carrying it usually look completely healthy. There are often no warning signs at all. But silently, those rodents leave the virus behind through their urine, saliva, and droppings. And once that waste dries out, the danger can become airborne. Tiny contaminated particles mix into ordinary dust and begin floating through the air, invisible to the eye and easy to breathe in without realizing it. In some environments, researchers say the virus may survive for days, especially inside cool, enclosed spaces with poor ventilation. That's why seemingly harmless places can suddenly become risky. An old garage, a dusty basement, a cabin closed for months, storage boxes sitting untouched for years, even an old vehicle with signs of rodent nesting, and this is where many people unknowingly expose themselves. The moment someone starts sweeping droppings, shaking dusty blankets, moving boxes, or vacuuming contaminated areas, those virus particles can launch directly into the air. Just breathing in that contaminated dust may be enough for exposure. And once the virus enters the body, it travels deep into the lungs and begins attacking the tiny blood vessels responsible for oxygen exchange. As those vessels become damaged, fluid can begin leaking into the air sacs of the lungs, making breathing harder and oxygen levels dangerously low. This severe condition is known as Hantavirus Pulmonary Syndrome. The stage doctors fear most because it can suddenly turn life-threatening. What makes this even more unsettling is how ordinary the exposure often feels. Many infected people thought they were simply cleaning a room, until days later they could barely breathe. And for older adults, the danger becomes even greater because aging lungs often struggle to clear harmful particles as efficiently as they once did. Why older adults face greater danger? Hantavirus can be dangerous for anyone, but after 60, the body often has far less reserve to fight an aggressive lung infection once it begins spreading. And that's exactly why health experts worry so much about older adults. As we age, the lungs gradually lose some of their natural elasticity and clearing ability. Tiny hair-like structures inside the airways, which normally help remove harmful particles before they reach deep lung tissue, become less effective over time. That means dangerous particles breathed into the air may travel deeper into the lungs than they once would have years earlier. And once hantavirus reaches those deeper air sacs, the infection can become much harder for the body to control. But it's not only the lungs. The immune system also changes with age. Researchers have found that older adults often experience a slower and less organized immune response, making it harder to fight sudden infections quickly and efficiently. This is one reason symptoms can escalate so fast. A younger person may clear part of the exposure before severe damage happens, but in older adults, the body often has much less margin for error once oxygen levels begin dropping. And what makes the situation even more dangerous is that the earliest symptoms usually don't feel alarming at all. In fact, many people initially believe they're dealing with nothing more than a common flu or seasonal illness. The early symptoms most people ignore. And this is where hantavirus becomes especially dangerous because the early symptoms often look almost harmless at first. For many people, it begins with what feels like an ordinary viral illness. Fever, fatigue, body aches, headaches, chills. Sometimes nausea or dizziness. One symptom health experts frequently mention is deep muscle pain, especially in the thighs, lower back, and hips. And because these signs look so similar to the flu, many people never suspect something far more serious may already be developing inside the lungs. But while the person believes they just need rest, the virus may quietly continue spreading through the body. And then comes the stage doctors fear most. Within just a few days, some patients suddenly begin struggling to breathe. The lungs start filling with fluid, oxygen levels begin dropping rapidly, and simple activities like standing, walking, or speaking can suddenly feel exhausting. This severe stage is called Hantavirus Pulmonary Syndrome, and once breathing problems begin, the condition can worsen frighteningly fast, sometimes within 24 to 48 hours. That's why rapid medical attention becomes critical. Many survivors later said the illness changed so quickly that they barely had time to understand what was happening before ending up in the emergency room. And now, to understand just how frighteningly fast hantavirus can turn dangerous, let's look at several real cases where ordinary people went from everyday activities to severe medical emergencies in just a matter of days. But before we move further, please take a moment to like this video and subscribe to For Seniors Health, where simple changes for seniors can lead to a powerful, healthy comeback. Real hantavirus seeks that shock health officials. One of the most frightening things health experts continue warning about is how often hantavirus gets mistaken for something minor in the beginning. Many people believe they just caught the flu or overworked themselves until the illness suddenly turns into a breathing emergency. And several real cases have followed that exact terrifying pattern. One survivor from New Mexico, Mark Reynolds, later shared how everything started after he cleaned an old storage shed behind his property that had obvious signs of mice activity. Like most people, he never imagined the dust in the air could become life-threatening. Mark said at first, everything felt normal, but about a week later, he woke up feeling unusually exhausted. He described it as the kind of weakness where your body suddenly doesn't feel like your own anymore. Then came the fever, the chills, the deep muscle pain in his back and legs. He told his wife he probably had the flu and tried resting at home, but by the next evening, something terrifying started happening. Mark later said it felt like someone was slowly tightening a belt around my chest every hour. He struggled to catch his breath just walking to the bathroom. Even speaking became difficult. His family rushed him to the emergency room when his lips started turning pale and he could barely breathe between sentences. Doctors later confirmed Hantavirus Pulmonary Syndrome after fluid rapidly began building inside his lungs. Mark survived after intensive medical treatment, but he later admitted the scariest part was realizing how ordinary the exposure had seemed. According to him, I never thought cleaning an old shed could almost cost me my life. And that's exactly why doctors continue warning people not to ignore possible rodent exposure, because once severe breathing problems begin, hantavirus can become deadly, frighteningly fast. And now that you've seen how real and unpredictable this virus can become, let's talk about the most important thing of all, the critical steps experts say can help protect you before exposure ever happens. Now, after hearing stories like Mark's, the question becomes incredibly important. How do you actually protect yourself from hantavirus before exposure happens? Because according to health experts, many infections occur not because people are careless, but because they simply don't realize how dangerous certain cleaning habits can become. So here are 5 critical protection steps every older adult should know. Safety tip 5, always check the area before you start cleaning. One of the biggest mistakes people make is rushing into old garages, basements, sheds, cabins, or storage rooms without first checking for signs of rodents. Health experts recommend slowing down and looking carefully before touching anything. Watch for rodent droppings, chewed boxes or wires, nests made from paper or insulation, strong musty smells, tiny tracks or signs of urine stains. Because if rodents have been active in that space, disturbing the area too quickly may send contaminated particles directly into the air, and many people don't realize they're breathing in danger within seconds. Safety tip 4, never enter a dusty rodent area without proper protection. This is where many serious cases begin. People walk into enclosed spaces thinking, I'll only be here for a minute. But poorly ventilated rooms can trap contaminated dust in the air for long periods of time. That's why experts strongly recommend opening doors and windows first and allowing fresh air to circulate before cleaning begins. And when rodent contamination is possible, simple cloth masks may not provide enough protection. Health experts often recommend properly fitted respiratory protection, like an N95 mask along with gloves and careful ventilation. Especially after 60, protecting the lungs becomes critically important because aging airways often cannot clear harmful particles as efficiently as they once did. Safety tip 3, never sweep or vacuum rodent droppings. This may be the single most dangerous cleaning mistake people make. Dry sweeping or vacuuming rodent droppings can blast contaminated particles throughout the room, making them much easier to inhale deep into the lungs. And this is exactly how many experts believe severe exposures happen. Instead, health experts recommend spraying contaminated areas with disinfectant or a bleach solution first and allowing it to soak before carefully wiping materials away. The goal is to prevent virus particles from becoming airborne. Because once those invisible particles are floating through the air, you may breathe them in without realizing it. Safety tip 2, never ignore flu-like symptoms after possible exposure. This is where hantavirus becomes especially dangerous. Many people delay seeking medical attention because the early symptoms seem mild at first, H's, fever, fatigue, headaches. But if breathing problems begin after recent rodent exposure, health experts warn the situation can become serious frighteningly fast. Doctors say early recognition matters because patients often deteriorate rapidly once oxygen levels begin dropping. That's why symptoms like chest tightness, severe shortness of breath, dizziness, or struggling to breathe should never be ignored after possible exposure. Safety tip 1, tell your doctor about rodent exposure immediately. And this may be the most important step of all. Many hantavirus cases are difficult to recognize early because the symptoms initially look similar to influenza or other respiratory illnesses. But when doctors know a patient recently cleaned rodent-infested areas or breathed dusty, contaminated air, it can help them identify the danger much faster. And faster recognition can save critical time. Because once severe lung symptoms begin, Hantavirus Pulmonary Syndrome can progress incredibly quickly. The important thing to remember is this. Most people who became seriously ill never believed they were doing anything dangerous at the time. And that's exactly why awareness matters so much. Because sometimes, a simple precaution taken today may prevent a life-threatening emergency tomorrow. Many people never imagine a hidden health danger could begin in such an ordinary place, which is exactly why awareness matters so much. The good news is that simple precautions and early attention can make a powerful difference. So here's a simple question to think about. After watching this video, will you clean old storage spaces differently from now on? Let me know in the comments below. We're building a community here to support your strong, healthy comeback. If this video helped you, I'd truly appreciate a like, and if you subscribe. And please share this with someone you care about. And join me in the next video for another simple step toward better health.